Good day, New Brunswick, and welcome to today's COVID-19 update for the province. Today, we will be hearing from Health Minister Dorothy Shephard as well as Deputy Chief Medical Officer of Health, Dr. Cristin Muecke. We are expecting today something along the lines of an update regarding whether or not we've hit that magical 75% number of eligible New Brunswickers being vaccinated. We were at 74.1% yesterday, so there's a good chance that that number is around 75 today, but we will find out in about 5 minutes. I know that we are on schedule. There are 83.9% of people in New Brunswick who've had at least one dose as well, so we are on our way in that direction. I do want to mention, if you are in the St. Andrews area on Saturday, Dr. Russell is actually, I don't know if you can see this on here, she is playing at Kira Amphitheater with her band, the big Jen Russell Big Band, at 2 p.m. on Saturday. We'll be live streaming it on CHCO's Facebook page and on television as well on Saturday. So if you are unable to make the concert itself, we will be able to show it to you on TV, live on Facebook, if you're watching from different parts of New Brunswick. Now, there are 164 active cases of COVID-19 in the province currently. There were 10 new cases of COVID-19 yesterday. In terms of a zone breakdown, there are 92 active cases in Zone 1, 17 in Zone 2, 28 in Zone 3, 2 in Zone 4. Zone 5 is the only part of New Brunswick right now that has no active cases. There are 5 in Zone 6 and 20 in Zone 7. Now, obviously, if you watched our news this week, the numbers in New Brunswick have made it so Nova Scotia has changed the protocol for New Brunswickers traveling in. They are now out of what we've known at this time as the Atlantic bubble and now must follow the same guidelines as people coming in from other parts of Canada. Now, if you're fully vaccinated, that doesn't apply to you. I suggest watching our news that's pinned to the top of our Facebook page if you want to hear a little bit more about what it means. But if you are unvaccinated, it means that you can still travel in. You just have to isolate for 14 days. And if you've had one dose, you have to isolate for a week, but also be subject to testing. So more information, I'm sure, will be asked about this and potentially even shared from Dr. Muecke and Minister of Health Dorothy Shephard at the start of the conference. But again, I am expecting that the main theme of today's conference is our COVID-19 vaccine numbers. So again, with back to school starting soon, there are so many questions that people have. I can tell you a little bit as we wait, though we are on time, so expect that we will cut right into the conference any minute now. Hospitalizations is a question many of you had. We have 3 people in hospital right now. So what number exactly a lot of you were writing in about? And again, please write in if you do have questions you'd like us to ask in these conferences. But a lot of you were concerned about what number it means if we do have any kind of new protocol or old protocols reinstated in terms of mask wearing, in terms of bubbles or number of close contacts. So when exactly would that kind of information be available for us to modify our green level? I do hear people in the conference room, so it sounds like we are starting shortly. Again, here's something else that's happening in the States that we are expected to hear of in the United States today. Potentially booster shot decisions might be made. So a lot of you are wondering if something similar will be decided in Canada at some point soon. I don't know. I've asked this in the past and they didn't have any decision made yet on where they stand in terms of booster shots. You probably hear a lot of background noise, which means we should be starting shortly. And that was definitely a question many of you had in terms of teachers. A lot of teachers last year were some of the first groups of people that were eligible for vaccines after frontline workers and certain older parts of the population. But that's been since, I think, some of the teachers I know, maybe February, March, when they received some of their first doses of a vaccine. So it is a question that will be coming up. I'm just going to turn the volume down because I don't think we have a feed quite yet from well, we do have a feed, but we don't see Bruce in the conference room. Bruce is there today. I know he was on vacation, for some of you that were wondering. So yes, so please do write in your questions to us. You can write them directly to me by email if you prefer. The easiest email to remember is just news, NEWS, at CHCO.TV. I get that as well as the rest of the news team, but I take all of your questions into consideration and I keep them usually on cue cards. I have papers today just so that we can make sure we get the questions you want answered in these conferences. And obviously we haven't been having as many conferences as you were used to having over the last year and a half in recent months due to our move into the green level, as well as I believe summer has a factor in that too. But again, I still try to prioritize the questions that most of you have so that we can get the answers that are most valuable to people in all of New Brunswick. I know there are a lot of you that are watching from around the province. I do say Southwest New Brunswick because that's where we are based. But we know that there are a lot of people watching from all corners of New Brunswick, and we're a small province. So usually what somebody wants to know in Southwest New Brunswick is something similar that somebody wants to know up north or out east as well. Now again, another question that some of you had was about the Delta variant and how prevalent it is in New Brunswick. From my understanding at this point, I believe it is the UK variant that has to do with the majority of the cases in the province, but it is on my list of questions today. Now, another question that you've had is about whether or not there will be an app available. I did mention that in our news report on Tuesday, that it looks like the government of New Brunswick is working on an app that would allow you to show your vaccination status. We're finding out that a lot of different businesses, organizations are making it so they want to be able to ask people that come into, not just people that work there, because again, Air Canada was another company yesterday that announced they were going to have a strict mandatory vaccine plan for their staff. Now you can, I think there are some health exemptions, some religious exemptions, but they are making it mandatory. They won't be instituting regular testing as an option, which some companies and organizations are doing, allowing people who aren't vaccinated to then submit to, sorry, it's just my earpiece, regular testing if they'd prefer. But some companies are going in a different direction and saying, no, there are very few exemptions. You either have to get a vaccine or not work there. So these are questions I'm sure will be asked in the conference today. And then the app, again, there are some businesses, if you follow some of our Facebook posts, there are even local businesses that are going beyond just doing something that is a staff mandate, however they stand on vaccine, but also saying people that enter the premises as customers, they would like to be vaccinated. So how are we going to go with this going forward? In what way can we present this information? I know these bulky vaccine sheets that we all have, there has to be obviously a different way to keep it with you, and I think they're planning so it's just something that's on your smartphone and you're able to show when you enter certain places that do require it. But again, these are all questions that we expect to have more answers to over the weeks ahead. So I know it seems like going green, there are less conferences, but I have a feeling there will still be quite a large number of conferences as we move into the fall and we adapt to how we live with COVID-19. We did have our first back to school conference last Friday, so that's on our Facebook page as well if you want to review it in terms of Minister Carty's plan for back to school and how he sees that rolling out for the fall. I would imagine we will have another one before school resumes, but I don't have word. Again, I always post this information on our Facebook page. For those of you who follow us on Facebook, as soon as I got word this morning that we had a conference today, I posted it there. Now, we have arrived. Bruce and Dr. Muecke and Minister of Health Dorothy Shephard have arrived in the conference room. So we should be going straight to the conference room any minute. I'm watching your Facebook comments online though as well. So if you're watching at home on your TV, I appreciate it. Someone just asked what channel. Across Canada, we're available on Bell Satellite 539. If you're in Charlotte County, you can watch on Rogers 126 or Ignite 133. And now we are heading to the conference room. I will see you after the conference.
Good morning, everyone. Bonjour tout le monde. Since moving into the green level of our COVID-19 recovery plan on July 30th, New Brunswick has seen a surge in COVID-19 infections. More people moving around provides more opportunity for the virus to find new hosts, so this is no surprise. La santé publique est
Public health is concerned by the recent increase of the number of cases throughout the province.
In particular, we are concerned by the number of cases where we can't establish a link to other existing cases. As of today, 13 cases in Zone 1, which is the Moncton area, and 1 case in the Fredericton area, have been classified as community transmission. This means we can't directly establish who the individual got their infection from. While our case numbers are higher than they have been in many months, the course of the disease and how we need to respond to it has changed with the vaccine rollout. Comparativement au mois d'hiver, moins de personnes infectées ont besoin de soins médicaux intensifs. Le 10 février, il y avait 175 cas actifs de COVID-19 au Nouveau-Brunswick, soit le total relativement semblable à celui d'aujourd'hui, qui est de 157. On February 10th, 2021, New Brunswick had 175 active cases of COVID-19. That's close to today's number of 157. On that day, there were 6 New Brunswickers in hospital, of whom 2 required intensive care. À l'heure actuelle, 4 personnes sont hospitalisées dans la province en raison de COVID-19, mais aucune d'elles n'a besoin des soins intensifs. En fait, aucune personne n'a été admise à l'unité de soins intensifs en raison de la COVID-19 depuis le mi-juin. La recherche des contacts continue de contribuer grandement au contrôle de la propagation de la COVID-19. Our contact tracing teams continue to do an excellent job, and I would say arguably one of the best in the country, and that is helping to limit the spread of the virus. The current surge in cases is centered in Zone 1, which is Moncton and southeastern New Brunswick. We have found that cases in other regions are linked to the Zone 1 area. The most significant difference between today and 6 months ago is the widespread availability of safe and effective vaccines. À l'heure actuelle, plus de 74% des citoyens de Nouveau-Brunswick sont complètement protégés contre le COVID-19. Il s'agit là d'une bonne nouvelle. Je tiens à remercier toutes les personnes qui se sont retroussées les manches pour se protéger et protéger leurs familles, leur collectivité et les personnes qui ne peuvent pas être vaccinées. Without the protection afforded by the vaccines and the tireless dedication of our public health contact tracers, our current situation would be significantly worse. We would have more cases of serious illness, more people in hospital, and more people requiring intensive care. And our restrictions would have had to have been more stringent than they are now. Because of the protection provided by vaccination and contact tracing, public health was comfortable with moving to the green level, given that the trend in vaccine uptake at that time was positive. We all needed to get on with our lives and begin living with COVID-19. Now, of course, we are adjusting. Vaccine uptake is changing and cases are changing. Le virus demeure cependant parmi nous. Les conseils et les recommandations de santé publique continuent de s'appliquer, même si l'arrêt obligatoire n'est plus en vigueur. If you are not yet fully vaccinated, your health remains at risk from COVID-19. Une personne non vaccinée qui contracte le COVID-19 est davantage à risque de devenir gravement malade et de ressentir des répercussions à long terme. Public Health continues to urge every eligible New Brunswicker to become fully vaccinated as soon as possible. Vaccination is the surest and most effective protection we have against COVID-19. Today, Public Health is reporting 8 new cases of COVID-19 in New Brunswick. 6 are in Zone 1, the Moncton region. 3 of these are contacts of previously confirmed cases, and 3 are under investigation. And there are 2 cases in Zone 3, the Fredericton region. Both of these are travel-related. There are now 157 active cases of COVID-19, 15 recoveries, and 4 New Brunswickers in hospital. Aujourd'hui, la santé publique annonce qu'il y a 8 nouveaux cas de la COVID-19 au Nouveau-Brunswick. Il y a 6 cas dans la zone 1, soit la région de Moncton. 3 de ces cas sont des contacts d'un cas déjà confirmé, alors que les 3 autres font l'objet d'une enquête. Il y a aussi 2 cas dans la zone 3, soit la région de Fredericton, qui sont tous les deux liés à un voyage. Il y a présentement 157 cas actifs de COVID-19 dans la province. 15 personnes sont rétablies, alors que 4 citoyens du Nouveau-Brunswick sont hospitalisés après avoir contracté le virus. The majority of these new cases continue to be among those who are not fully vaccinated, whether by choice or because they are not yet able to receive a vaccine. If you are not vaccinated, there are steps you can take to protect your own health and the health of those around you. I strongly recommend that New Brunswickers pay close attention to the public health practices learned during the pandemic. Wash your hands frequently and thoroughly. Maintain 2 meters between yourselves and others wherever possible. Stay home if you don't feel well. Watch for symptoms of COVID-19 and get tested if symptoms emerge. Toutes ces couches de protection demeurent également importantes pour toutes les personnes de Nouveau-Brunswick. Given our current case numbers and the evidence of community spread, I urge all New Brunswickers to continue to wear a mask when they are in indoor public spaces. It is true that masks are not currently required by law as they were earlier in the pandemic. But remember, we're dealing with a communicable disease that can and will spread quickly among the unprotected. If you want to protect yourself and your family against COVID-19, your best option is to get vaccinated. If that is not your choice or that option is not available to you, my advice is that you continue to wear a mask and limit your contacts as much as possible. To stop the spread of a communicable disease like COVID-19, it is important that we're able to apply multiple layers of protection to slow the spread of the virus. Les vaccins constituent un moyen de protection important pour prévenir la propagation de la COVID-19. Nous devons cependant avoir recours aux autres outils à notre disposition, comme les masques, pour protéger la population aussi efficacement que possible. It is also critically important that everyone cooperates in helping us to trace the course of this disease. Si un représentant de santé publique communique avec vous, veuillez répondre à votre téléphone, être respectueux, répondre avec franchise et politesse aux questions posées par les membres de notre équipe de recherche de contacts et suivre les directives qu'ils vous donnent. And I'll repeat that in English. If a public health representative or team member contacts you, please answer your phone, be respectful, respond frankly and with politeness to the questions posed, and follow the directives that are given to you. Isolation of those who are infected or could be infected remains a key element in our strategy to limit the spread of COVID-19. Please note that public health directives will depend in part on each person's vaccination status. Unvaccinated or not fully vaccinated people exposed to the virus will have more restrictions placed on them than vaccinated people who are in the same situation. Currently, there are more than 1,000 New Brunswickers who have isolated themselves to help us limit the spread of this disease. Je les remercie tous de faire ce sacrifice pour protéger leurs familles, leurs collectivités et les personnes non vaccinées. La COVID-19 est toujours parmi nous et nous commençons tout juste à apprendre à vivre avec ce virus. Yes, we have seen an increase in cases over the last month. But we're not seeing the concurrent increase in serious illness and hospitalizations that would jeopardize our healthcare system at this time. Le rythme de vaccination a ralenti, mais il semble s'accélérer à nouveau, au fur et à mesure que les familles reviennent des vacances et se préparent à la rentrée scolaire. Cette constatation me donne espoir. Tous les jours, de plus en plus de citoyens de Nouveau-Brunswick reçoivent le vaccin contre le COVID-19. Given the highly contagious nature of the new variants of COVID-19, we need to get as many New Brunswickers as possible vaccinated as soon as this can be done. Pour contenir l'augmentation du nombre de cas de COVID-19 que nous vivons actuellement, nous devons continuer à travailler ensemble. You can contribute by getting vaccinated and encouraging those close to you to get vaccinated. You can contribute by helping us trace and contact potential cases. You can contribute by wearing a mask if you have not yet fully received a vaccine series. We have come a long way by working together, and it's one of the features of our response to COVID-19 in New Brunswick. Please continue to do this for your own sake and for your fellow New Brunswickers. Thank you very much.
Good afternoon, bonjour. Over the past month, we have all been adjusting to life in green. We've been learning how to live our lives as normally as possible with the continued presence of COVID-19. Some New Brunswickers have embraced this transition, but I know for some, it has not been easy. The good news is that our vaccine rate is still steadily increasing. As of today, 74.2% of eligible New Brunswickers have received both doses of the vaccine, and 84% have received their first dose. As of this morning, we have administered an impressive 1.1 million doses of vaccine in New Brunswick. We're also beginning to see a promising rise in the number of people booking vaccination appointments. Over the past few weeks, an average of 6,000 New Brunswickers have booked an appointment. But this week, that number has jumped to around 8,000 appointments. As we head into the fall, I'm hopeful that even more people will choose to get vaccinated. We know that this is absolutely the best tool we have to protect ourselves and our loved ones. The new school year begins soon, and as Minister Carty announced last week, we have a plan in place that will allow students to have as close a normal school experience as possible. I want to ask parents to do their part to ensure the school year goes smoothly. That means ensuring you and any adults in the household are fully vaccinated. And if you have children who are 12 and older, including children who will be turning 12 before the end of 2021, please book an appointment to have them vaccinated if you have not already done so. As of today, 59.4% of youth aged 12 to 19 have been fully vaccinated, and 73.8% have received their first dose. We are on the right track, but we hope to see those numbers continue to rise in the weeks ahead. There are appointments available throughout the province, and you can schedule yours by contacting a pharmacist directly or by visiting www.gnb.ca/bookavaccine for an appointment at a Horizon or a Vitalite network clinic. We are continuing to offer walk-in clinics where no appointment is required. For example, tomorrow, Friday, August 27th, Extramural and Ambulance New Brunswick is offering a Pfizer-BioNTech vaccine clinic for first or second dose at Parley Beach in Shediac between 2 p.m. and 6 p.m. Additional walk-in and mobile clinics will continue to be posted on the GNB COVID-19 website. We should all feel encouraged that nearly 75% of our eligible population is now fully vaccinated. But with the presence of the variants in our province, we must aim above and beyond that goal. The more people get vaccinated, the more we will all be protected from COVID-19. We know that being fully vaccinated provides a high degree of protection against this virus. As Dr. Muecke explained, the vast majority of people who have tested positive for COVID-19 since the beginning of July were not fully vaccinated. Those New Brunswickers who have been vaccinated can access their immunization record through MyHealthNB. If you have already been vaccinated and do not have a MyHealthNB account, you can receive a registration code by booking an appointment at a Horizon or a Vitalite clinic. At the appointment, staff will verify your identity and your NB Medicare number and will give you a registration code that you can use at myhealth.gnb.ca. Your paper record of immunization is still your official record, so please keep it in a safe place. Keep a copy, take a picture of it if you haven't already done so. I want to thank everyone who has done their part by getting vaccinated already. You are playing a very important role in getting us through this pandemic and making it possible for us to return to a more normal life. As our vaccination rate continues to increase, we will all feel more comfortable living with our lives in a more free way. Learning to live with COVID-19 is a process. This is something we will get through, as we have throughout the pandemic, by working together. Thank you. Merci.
Thank you, Minister, and thank you, Dr. Muecke. Merci, la ministre et Dr. Muecke. We'll now proceed with questions from the media. Each reporter will have one question and one follow-up. You have the right to pose your question in the official language of your choice, and please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question puis un suivi. Veuillez vous assurer de déactiver le son de vos micros. Laura Brown, CTV.
Hi, either of you hopefully can answer this. Wondering if parents should be concerned, specifically in the Moncton area and those who have kids under the age of 12, about sending their child back to school next week, specifically again in that area.
So as was communicated last week, there is a plan for the opening of schools that incorporates protective measures into the daily routines of kids at school. We do have to keep in mind, as we have throughout the pandemic, that there are various factors and priorities that need to be taken into consideration. Obviously, infection control and the protection of children from that perspective is paramount. That being said, of course, we also want children to get a good education. We also want children to have good physical, mental, social, and emotional health. So all of these things are considered, but we continue to watch the situation very closely, and we will be working with our partners at EECD and continuing to evolve our evidence as needed, or as our advice is needed.
And I know that it was released yesterday, but can either of you tell us the breakdown of the Alpha versus Delta variants currently in the province, including the cases today?
We have both Alpha and Delta variant in the province currently, and both of them are known to be more transmissible than the original version of the virus. So it is important for us from the perspective of understanding the dynamics of transmission. But in terms of what people do on a day-to-day basis and what protection measures they take, there's not a big difference in that respect. So it is, regardless of whether it's Alpha or Delta in your local area, it's really important for you to pay attention to public health measures.
Breakdown of the numbers though?
I probably do.
I'm trying to find them as well. I know I saw them. There were 4 cases of Delta in the province, if my memory serves me correct. Yeah, I don't see it here.
Okay, yeah.
We'll get that
We'll
for
get
you,
back
though,
to you
Laura.
with the exact
Absolutely. Yeah.
numbers. Thanks.
Natalie Sturgeon, Global.
Hi, so we sort of talked to experts who said that disavowing masks and sort of getting rid of the COVID protocols was the wrong move right now as we enter the 4th wave. What do you make of that, and what will you be doing to sort of protect New Brunswickers as you go forward, and will you reinstate a mask mandate?
So as I alluded to with the school question, this is an evolving process. This is an evolving situation. And we are always looking to create that fine balance between what we need to do to control the pandemic and various potential unintended consequences of the restrictions that are put in place. So all of that is an ongoing discussion, and as you can see, situation can change very quickly. So we continue to look at that on an ongoing basis, which is why the messages you're hearing now are different than what you would have heard 2 weeks ago. All options are on the table and continue to be discussed, and so as various measures need to be put in place, we'll be not only discussing them, but communicating them to the public.
And-
Can I just add to that?
Yes, absolutely.
So and as Dr. Muecke says, we've, every single day, we still continue to have the pulse of COVID-19 at our fingertips, and that's really important. We will always make our decisions based on the best available data on any given day. I look in this room and I see no less than a half a dozen or more out of the 9 people sitting in front of me that are wearing masks. The public has grown to understand through our COVID reality that they have the opportunity and they have the power to protect themselves against COVID-19. The vaccinations are, of course, I think our biggest tool in the toolbox. But we know that wearing masks in indoor public spaces is a smart thing to do. We know that keeping your distance and washing your hands frequently are other smart things to do. And our public has been educated to that. And I still see people today, we wore masks walking in here today. So the fact is that our public has really learned, and they know that we're transitioning to living with COVID. And you know, I would never say never, but we will evaluate it with the best data we have on any given day with the assistance of public health.
Minister Shephard, the Campbellton ICU is going to be shut down due to staffing shortages. We are seeing hospitalizations for now. Premier Pig said that would be something he would react to in terms of the emergency measures or restrictions. So are you considering that? Have you had any conversations about reinstating restrictions?
We have 4 hospitalizations, absolutely, we'll be monitoring that. But of course, look at the case count and how high it is. We don't have anyone in ICU. And so, again, we will be making our decisions based on the best available data on any given day. Public health and government, you know, our cabinet have worked very, very well together, including with the cabinet committee. We knew this would be a tough summer. We knew with our human health resources, this was going to be a tough summer, and it has played out as we've been expecting. So what we need to do now is assure that, you know, we take steps with the solutions that could be before us. And so we're going to be working very closely with our RHAs, with Extramural, Ambulance New Brunswick, 811, our MBMS, our nurses associations and unions. All of us need to come together to work on the solutions.
Savannah?
This is for Dr. Muecke. So I just want to clarify, when you're urging people to wear masks indoors, is that a recommendation from public health? And if not, what exactly is that going to take if we have 14 community spread cases and 4 in hospital, which it is low, but that's obviously severe illness in that case? So
Yes, that is a strong public health recommendation at this time. And as I mentioned, we're working at looking at all possible options in terms of reinforcing our messages, as well as encouraging as many people to get vaccinated as possible. So we're working at all of those initiatives concurrently to ensure that we provide the best possible options to New Brunswickers.
And just as a follow-up to that, if that's your recommendation, in schools should we expect that students are also to wear masks in school now, in classrooms as well, if that's a suggestion from public health?
You would have seen last week in the schools plan, there's already provision for masks in common areas. Yep, so we would be looking regionally to see if there's anything additional required. It does indicate in the schools plan that public health would do a risk assessment in individual areas or individual schools, and we can recommend additional measures if we feel that they're needed.
Thanks, Savannah. Jacques?
So we'll probably hit the 75% number in a few days, and that number used to be the threshold for lifting restrictions. Does that specific number mean anything from an epidemiological point of view?
So there would have been early modeling that was done, primarily based on the experience in the pandemic to that point, which was typically the traditional version of the virus, that would have suggested that 75% was a good target to aim for. The modeling continues to evolve as does the situation. And of course, we have many more variants in play now than we would have not that long ago. And so as a result, our messaging has also evolved. We do see modeling that suggests that higher vaccination rates are important in the context of the Delta variant, for example. And so now our message is really, we want as many New Brunswickers as possible to get fully vaccinated.
So if 75 specifically doesn't mean any change in terms of spread or herd immunity, why not put out a number that would? What number does mean something?
Well, I guess it's the same issue as we would have had with the 75, which is there's no magic bullet associated with that number or probably with any other number. These are numbers that are based on modeling. And this is a new disease with new transmission dynamics. Oftentimes when we're able to establish a hard number for other vaccination coverage rates, say for measles or other diseases, that's based on a much longer period of experience with those diseases. And so it does become a little bit easier to nail it down. But for the purposes of public participation, I guess we just want to make sure that people know we need as many of them to roll up their sleeves as possible.
Thanks, Jacques.
Thank you.
Isabelle Arsenault, Radio-Canada. Hadil Ibrahim, CBC.
Hi, can you hear me all right?
Yeah.
Great, thank you. This is for Dr. Muecke. You said the majority of cases are people who are unvaccinated either by choice or they've not been able to get vaccinated. Do you have a breakdown of how many people are the former and how many are the latter? And can you expand on what you mean by unable? Is it just age or are there more reasons?
So no, we wouldn't have a breakdown because we don't know the features of people that don't show up. That being said, there are people who, as we know, who don't get vaccinated by choice. There are a limited number of people who may not be able to get vaccinated for medical reasons. And then, of course, as you mentioned, there are people that are not able to get vaccinated because the vaccine has not been authorized in their age group.
Do you have a follow-up, Hadil?
Yes, we know that vaccinated people are not less likely to contract the disease, but they're less likely to develop symptoms. So considering that and the 14 untraceable cases, how can we know how bad the spread really is? Like, have we lost the ability to do that?
So the evidence does continue to emerge. We do find, of course, that there's significant decreased likelihood of getting severe disease, being hospitalized, and dying of COVID if you've been vaccinated. There also continues to be emerging evidence that people who are vaccinated are less likely to transmit disease if they do get a breakthrough infection. So all of those pieces interplay in terms of the benefits of vaccination. As far as whether we're in a more difficult position, obviously that when we start to have more difficulty making linkages between cases, there's less direct advice that we're able to give to individuals, but which is why we're sending some messages in this manner as well now, which is really we want everybody to consider and follow public health advice so that we can get this under control.
Thanks, Hadil. Vicky Hogarth, CHCO-TV.
Thank you. I'm just wondering about the 14 new community transmission cases. Were any of those cases in people under 12, and have you seen an increase in people under 12 contracting COVID in recent months?
I don't have the breakdown of the 14 in terms of age group, but I can tell you that as a general trend, that the cases that of COVID-19 that we're seeing are more likely to be younger. And when I say younger, I mean under 40. But that's just in part a reflection of the vaccine coverage rates by age group as well. We have our highest vaccine coverage in our elderly population, which is obviously important because they're also traditionally at highest risk of severe outcomes. So in part because of that, and in part because of coverage rates and authorization by age group, we are seeing more younger cases, yes.
Do you have a follow-up, Vicki?
My follow-up is just we're at 74.2% of the eligible population being fully vaccinated, but do we know what that percentage is overall in terms, are we looking at 2/3 of the population if we consider everyone, and should we be aiming for a higher number this fall with the Delta variant at play?
Yeah, so most of the country follows eligible population when they're determining their vaccine coverage rates. We have looked on several occasions on what that would look like if we used the total population. Typically, it does reduce the number by a bit less than 10%. So for example, if we see 74% fully vaccinated, it would be somewhere in the range of 65 to 66% if we counted absolutely everybody in the province.
Thanks, Vicki. Tom Bateman, Brunswick News.
Good morning. Can you hear me?
Yep, I can hear you.
Great. Hi, Minister Shephard. The federal Liberals made a point of criticizing Saskatchewan's private MRI clinics, calling it, a trend towards the privatization of healthcare. They told me they're intent on enforcing a federal policy that could see health transfer deductions to provinces be clawed back in the coming years. Do you know what this could mean for New Brunswick and how entities like the Moncton MRI Clinic or maybe even nurse practitioners practicing outside of the RHAs could affect what New Brunswick receives? Thank you.
Can I just clarify, because I was tied up with a family funeral yesterday, so I'm not sure I'm up to, so are you telling me the federal Liberals are saying that they don't want to fund private clinics?
I'm sorry, I can't really hear you. Could you
Sorry, so what I said was, Tom, just to understand the question, are you telling me that the federal Liberals have announced they don't want to fund private clinics?
No, they don't want to fund them. In fact, they intend to claw back health transfer funding in provinces where these private clinics are operating, is what they told me.
I understand. I think I understand what you're asking me. So I guess I would say that it pretty much looks like the height of hypocrisy, since they've already withheld funding to New Brunswick for funding private clinics, for not funding private clinics. So I think they need to look themselves in the mirror and ask them what their policies really are going to be.
Tom, do you have a follow-up?
I do, on another topic. I heard this morning that there's a meeting planned between government officials and private colleges and post-secondary schools kind of regarding the health measures in place there. Will public health recommend mandatory vaccines for people involved with those institutions? And if so, why hasn't it happened yet, given the changes we saw last week with public universities? Thank you.
I'm going to go speaking on some anecdotal information I have, but not, I won't say that I've had a full confirmation and briefing from PEDAL on this. So let me just say that with the government of New Brunswick's policy on vaccinating GNB, asking GNB employees to choose between vaccination or testing policies, the universities, I think all of our universities and institutions in New Brunswick are now pretty much on board with accepting that they want to have the similar policy. So we may have to confirm that for you, Tom, but I believe that if there is a meeting taking place, that it will be centered around GNB's policy that we've just brought forward, and I think that they are all pretty much voluntarily following suit.
Yeah, that's my understanding as well, Minister. And just to add, though, as well, that we've had regular connections between public health and our post-secondary institutions throughout the pandemic. And so this would probably be following regular communication, because they are an important partner in our response.
I think he was asking about private universities that aren't funded or regulated by the province.
And I think, though, I think I'm including those, Jacques, that I believe they're all following suit. So we need to get that confirmed, because I didn't know that there was a meeting happening this morning. It's probably being managed through PEDAL in that regard, and maybe with public health. But I think I'm not aware of any that haven't indicated they would be heading in this direction.
Thanks, Tom. Alexandre.
Yeah, thanks, everyone.
Alexandre Boutreau, l'Acadie Nouvelle.
Bonjour, est-ce que vous m'entendez?
Non, on ne peut pas entendre.
OK. Est-ce que c'est mieux maintenant ou?
Oui,
I can hear good here.
oui, c'est correct.
All right. Je vais essayer de parler clairement. Le premier ministre avait dit la semaine dernière que le gouvernement allait demander aux entreprises aussi d'obliger la vaccination pour leurs employés et leurs clients, puis qu'il espérait que les entreprises allaient emboîter le pas au gouvernement. Est-ce que vous avez plus de détails là-dessus? Quand est-ce que vous allez demander aux entreprises d'obliger la vaccination?
Alors, c'est par rapport à l'initiative fédérale, c'est pas tout?
Pardon?
Tu as dit que c'est par rapport à une directive fédérale pour leurs employés?
Non, c'est par rapport à ce que le premier ministre Higgs a dit la semaine dernière. Il a dit, quand il a annoncé que la fonction publique devrait être vaccinée ou subir des tests réguliers, il a aussi mentionné que les entreprises, que le gouvernement a aussi demandé aux entreprises d'obliger la vaccination. Donc, qu'est-ce que vous pouvez me dire par rapport à ça?
I think I could speak to that perhaps. I believe that as GNB has taken our steps, I believe there has not been a directive to businesses in the community. What I do think is happening are conversations about GNB's steps and then how that might transition into the business community. We know that in other provinces, I believe some businesses are being given directives to ask for vaccinations, but I can't speak to that and confirm it for you. At this time, we are focused on GNB and the institutions and third parties that work with GNB.
As-tu une suivi, Alexandre?
Oui. Quand est-ce que vous allez pouvoir clarifier un peu les détails de cette vaccination obligatoire-là? Le premier ministre avait dit qu'il allait clarifier les détails plus tard. Où est-ce que vous en êtes dans la préparation des détails de ce plan-là, par exemple pour les foyers de soins?
So there was a directive sent out even this morning by our Chief Clerk of the Executive Council, Cheryl Hansen, and head of the Public Service and the vaccination policy to all GNB employees this morning. It clarifies the policies for current employees, future employees, and I believe even third party, yes, on-site vendors, suppliers, contractors, and volunteers. That's why this is a very comprehensive mandatory vaccine and/or testing policy. We know that we need to protect our children that can't be vaccinated, and anyone else in community who at this time cannot be vaccinated. And we know that the highest number of vaccinated population we have, the better our communities are going to be for it. And so that clarification went out today.
Merci. Travis Fortnum, Global.
Hi there, can you hear me?
Yes, we can hear you.
Cool. So my first question is for Minister Shephard. So we're hearing of ICU closures in Campbellton due to staffing shortages, and staffing shortages seems to be a problem in the healthcare system we keep hearing about this summer. So I'm wondering if you could speak to what the Department of Health is doing specifically to fix this problem.
Well, as you know, this is not a problem that's happened overnight. This has been a longstanding issue that's been accumulating. We spoke at the beginning of summer that this was going to be a very hard summer. It is coming to fruition. So we absolutely are working with our partners with Vitalite, Horizon, Extramural, Ambulance New Brunswick, 811, the Nurses Union, the New Brunswick Medical Society, to bring all these partners together to start really focusing on the solutions that are going to have to happen. Some of this will be conveyed in the health plan. Some of this is being put into action every single day within the networks. It is regrettable that some programs need to be temporarily halted in support of other things like emergency rooms, and making sure that we have strong personnel there to support ERs. But the fact is that you will be seeing measures of and opportunities of solutions coming forward in the very near future.
Travis, do you have a follow-up?
Yes, I do, and I'm not sure who wants to take this one, but again about Campbellton, this is a region and a public health zone that hard in previous waves of the virus and still hasn't caught its breath, so to speak. We're constantly hearing we're on the cusp of a fourth wave. Can Zone 5 afford to go without its ICU right now?
Well, again, we make our decisions based on the, the available and current data of the day. And so we don't want any services temporarily, suspended. But the fact of the matter is, it is far safer to make these decisions in advance of having a crisis happen and not having the staff to fully support measures that need to be taken.
Thanks, Travis. Maya Chabel, Radio-Canada.
Oui, bonjour, est-ce qu'on m'entend comme il faut?
Oui.
Oui. Donc, ma question est dans la même veine, c'est aussi par rapport à l'hôpital de Campbellton. Je voulais savoir, par rapport à ce que vous avez dit, vous travaillez avec Vitalité. Est-ce que, donc c'est une question pour la ministre Shephard, est-ce que vous avez toujours confiance en la direction du réseau de santé Vitalité?
I haven't any reason to question the management of Vitalité. We forecasted this would be a difficult summer. And Vitalité has had to take steps, just like Horizon has had to take steps, in order to ensure the safety of our health human resources and the community. And so as services must be suspended on a temporary basis to get through our human health resource crisis, then they must need to do that. We can't have questions in community about whether something is safe to operate. And so it is better to take these decisions in advance of having a crisis happen and us being in the middle of something that could have been prevented.
As-tu une suivi, Maya?
Oui, donc ma deuxième question, il y a le maire de Pointe-à-la-Croix au Québec qui se disait inquiet pour une partie de sa communauté qui travaille à l'hôpital régional de Campbellton. Alors, je voulais savoir, est-ce qu'il y a des choses qui vont être mises en place pour protéger les employés?
I don't think I understand the question. By protecting the staff, I don't understand what you're alluding to.
Protéger finalement ceux qui sont employés, est-ce qu'il y en a qui vont perdre leurs heures? Est-ce qu'ils sont juste transférés vers d'autres unités? Si l'hôpital ferme un jour, qu'est-ce qui pourrait se passer avec les employés?
Well, I see what you're asking. So the measures that are being taken right now is to close the ICU. I believe in favor of making sure that we have full complements of staff in the ER. So there's no indication that there's any kind of layoff. We don't want to lose one staff member to the system. And so we will be utilizing all staff.
Merci, Maya. Bobby Jean McKinnon, CBC. Bobby Jean, are you there?
Can you hear me now?
Yeah, yes, I can hear you.
Sorry about that.
That's okay.
This is a question for both the minister and Dr. Muecke, please. The province's messaging has changed dramatically since we moved to green, asking people to make a lot of decisions for themselves while cases rise higher than in other Atlantic provinces. But we're in uncharted territory here, and we still have people who are unable to get vaccinated, who are vulnerable and feeling abandoned. Who is looking out for them? What do you say to them?
As we've alluded to previously, we're continuing to look at the situation very carefully. We are looking for New Brunswickers to work with us to implement as many public health measures and carefully follow public health directives as possible. So we are continuing to look at all the possible options to ensure that all New Brunswickers, including those that are the most vulnerable, are protected in this situation.
And I guess I can say is that any New Brunswicker who wants to get vaccinated can get vaccinated. And I know that leaves a small portion of our population who cannot get vaccinated, perhaps for medical reasons. And that is why our message must be, we need every single New Brunswicker who can be vaccinated to get vaccinated. This is about protecting you, your loved ones, and your community. And so that message can't be any stronger than we've said. It is proving out that vaccinations work, and we need everyone to do it. And with regards to anyone who's vulnerable, they have also measures they themselves can take to protect themselves. And we encourage that all of the options that they have on the table be utilized.
Bobby Jean, do you have a follow-up?
Yes, I do. Thank you. There are still 60 schools with no integrated mechanical ventilation systems, and the Department of Education says only some will get new ones next year, but it will be a multi-year project. What is public health's position on this, both in terms of COVID and the heat waves we've been seeing this summer?
So we've continued to work with education. Actually, we've had a ventilation working group that's been in existence for months, really throughout most of the pandemic. So we've continued to work on this issue and provide advice, look at the situation in the schools. This is one of several layers of protection that can be applied, whether it's in schools or in other buildings that have ventilation. And so we're looking to optimize as much as possible, understanding that it's just one piece of the puzzle.
Thanks, Bobby Jean. Alex McDougall, Bangor Daily News. Alex, are you there?
Hello, can you hear me?
Yes, yes, we can.
Okay. Hi. So my follow-up is, just my first question is, with regards to the border between Maine and New Brunswick, Maine is currently seeing, Aroostook County in particular on the border, is seeing an increase of COVID cases. We have about, I think like 190 here in just Aroostook County alone. So is that something that is of concern with regards to now that the border has reopened for American travelers, or is because of are there any sort of concerns regarding that?
Well, I think travel is always a concern for us because we know it's our number one way of entrance into the province for any virus that we're dealing with. And I think that's why we have the restrictions still that we have. We are expecting that those individuals who are traveling into our province are double vaccinated and 14 days post. And, you know, that's probably the best protection we could have. And we also have, you know, policies in place for someone who might have one vaccination or no vaccinations. So I think that really it's about monitoring, it's about the travel registrations, and it's about implementing and enforcing policies that will keep the majority of our population safe.
Alex, do you have a follow-up?
Yes, sort of on a related note, with regards, I know with the border is still closed for New Brunswickers to travel over the land border, but they could still, you know, go to Halifax and maybe fly into the country. So are there any sort of advisories against the United States right now, the high number of cases here?
If there were any advisories, it would be done at the federal level. So we have to rely on their federal policies to help us control and protect the population.
All right.
Thank you, Alex. So that concludes today's update. Thank you, everybody. Voilà la fin de notre mise à jour.
That concludes today's COVID-19 update for New Brunswick with Dr. Muecke and Minister Shephard. Now, just for a quick recap, there were 8 new cases of COVID-19 in the province today. 6 of those were in Zone 1, that's the Moncton region, and the other 2 were in Zone 3, that's the Fredericton region. I was wrong at the beginning of the concert when I thought maybe we would hit the 75% eligible number of New Brunswickers being fully vaccinated. We're at 74.2, so we're probably at least a couple days away from hitting that magic number we've been aiming for. There are 157 active cases in the province right now. 89 of those are in Zone 1, 17 are in Zone 2, 28 in Zone 3, 2 in Zone 4, 0 in Zone 5 still, 4 in Zone 6, and 17 in Zone 7. I know someone just mentioned this on Facebook. John, hello, I know you're watching right now. We do have a Dr. Russell, well, I guess her band is called the Jen Russell Big Band, playing here where we're based in St. Andrews on Saturday at Cura Amphitheater at 2 p.m. It's free by donation to the United Way. We will be there covering it live if you can't make it. We will be streaming it on the Facebook page, so follow us there. When we go live, it will be directly on Facebook, and I think TV as well, but I'm sure someone in the back will tell me in my earpiece right now if I'm wrong. I appreciate you joining us today. I will post on Facebook the next time we have a conference as soon as I hear from the province, and you can watch it again right here live. I'm Vicki Hogarth at the CHCO News Desk.